This is the atrial fibrillation case demo, and we are presenting a patient. His name is Vincent Blanc. He's 47 years old male who had a recent history of very strong palpitation and lightheadedness, and the patient was referred to the cardiologist because the general practitioner did not find anything major. So the patient was referred to our hospital, and we did a standard non-invasive cardiological assessment, including electrocardiogram, exercise stress test, echocardiogram, and Holter monitoring, which is 24-hour recording of the electrocardiogram on 12 leads. This latter exam showed paroxysmal atrial fibrillation, so brief episode of atrial fibrillation, and for this reason the cardiologist decided that was a good idea to have a longer term monitoring to see how these arrhythmias developed. So the patient was enrolled in the MobiGuide system, was activated on the atrial fibrillation guideline. There is some pieces of the menu missing here. Okay, I need to select that and then okay, because this was already done before. So we have enrolled the patient in the atrial fibrillation guideline, and we now have to again personalize the personal content, which is already being done, but this basically is a way to manage the patient in different conditions. We have different routine monitoring periods, and we have also frameworks to put physical activity monitoring and semi-routine environment, which may mean vacation or other way of living different from the normal routine of the patient. This has already been shown in the previous case. So we have diagnosed our patient at this point with paroxysmal atrial fibrillation, and this is the diagnosis. Is no low atrial fibrillation. Most importantly, for what we are going to see later on, is that the patient does not have any accessory pathway that changes the guideline. Then the cardiologist also noticed an history of hypertension and non-insulin dependent diabetes, and therefore using the MobiGuide interface we have calculated the thromboembolic risk, and most importantly, using the CHUD score we have calculated that the patient has a score of 2, which is an indication from the guideline of atrial fibrillation to start oral anticoagulant therapy. Since the patient also had atrial fibrillation and paroxysmal, we decided to prescribe flecainide as an antiarrhythmic drug, and so we go to the prescription page. We go here, we prescribe flecainide starting from today for, let's say, 1 month for rhythm control, and we put the dosage and the time the patient has to take the pills. It's basically 2 pills a day of 100 milligrams each. with no day to skip. So we save. Okay. At this point we have this prescription with flecainide. We may add a response here. You can see that the guideline is still inactive, and we have to now activate the guideline. Okay, and now we have guideline ready. So at this point the patient is discharged. And with the MobiGuide system with that scheduled monitoring period, is discharged on antiarrhythmic drug. So after a few weeks the patient has symptoms, and he activates the mobile to make the system aware that there is again one symptom, even despite the presence of flecainide therapy. So the patient with the mobile has to
switch the. So basically, I'm going to report a symptom, and I do this by clicking the 6 smiley at the top, and I'm going to insert palpitations of a level that are unacceptable. Following that, I will get the instructions to start a monitoring session. Okay. So the system is telling me to wear the sensor belt. I have put it on already. So now I will just press start, and the system will begin measuring various physiological parameters.
Okay. In the meanwhile, from the doctor's side, we have the patient with flecainide and oral anticoagulant therapy which is being prescribed. So we may take a look at the clinical history of the patient, how it comes from the EMR of the patient, so the data already stored in the hospital system. We can double check this history of diabetes and hypertension. We may check whether the patient already had hospitalization. In this case we have one hospitalization a couple of years ago, and we can check whether it is something related to heart problem of others. In this case we have pneumonia, so it doesn't really had anything to do with the atrial fibrillation. We may check allergies and other events. So at this point we can also check blood tests, and we have a list of blood tests to check again from the EMR of the hospital, so it's data they are directly taken from there. And at this point we can check on the band measurement session whether we have the data coming in from the patient. So
I stopped the session now, and the session is being transmitted, I think.
Okay, so this is the atrial fibrillation summary that the recording has arrived to the caregiver interface. We have one episode. Of course, this is a simulation, so we have 0% of irregular beats, but we may have very useful information here, because we have the percentage of beats of irregular heartbeat, percentage of time, and we also have average heart rate, minimum and maximus, that may be very helpful to optimize the therapy in terms of rate, if we have a patient in rate control. And we have the standard deviation of the RR interval that give us an idea of how much the heart rate changes, and therefore again we may decide different therapeutic approaches depending on the type of atrial fibrillation that we can detect from here. So basically what we see in this simulation is that the patient has a switch from paroxysmal atrial fibrillation to permanent atrial fibrillation. So we have to change the diagnosis. We have to add a new diagnosis here. So let's say persistent atrial fibrillation, starting from today. First episode date we don't know in this case. Last episode, okay. So we save this data and said okay. At this point, we have to have the patient into the hospital because we need to activate and take a decision based on this new diagnosis that has been done using the MobiGuide system. Because we have a switch from one diagnosis to the other, so of course the treatment changes. We talk with the patient and we decided to go with electrical cardioversion. And so we start a visit using guideline assistance. Okay, we have a summary here of everything. We have our treatments, and so we save because all these data are correct. Our visit goal in this case is rhythm control with cardioversion, because we have decided to go for electrical cardioversion. The therapy location is the hospital, because this kind of intervention has to be done in the hospital. And we start with the guideline assistance. We have guideline ready, and we will see shortly that the status of the guideline will be switched to guideline active for these patients. So at this point we may show the list of recommendation for this patient, and we see that indeed direct current cardioversion can be useful to restore sinus rhythm as part of long-term strategy for this patient. So the guideline support our decision of electrical cardioversion, and therefore we schedule the intervention with the patient. As a side observation, we may check twice the guideline here for the cardioversion. If we may choose different and look whether everything is correct as it is in this case. And so we schedule the electrical cardioversion, and through the assistance of MobiGuide that allowed us to confirm that the cardioversion is indicated in this case. By the way, for educational purposes, we also put all other parts of the guidelines as a summary, so the physician can check anytime. That's it.